prick testing is done in the office and the results are relatively quick, like immediate at the time of the visit. Patch testing is often a week-long endeavor. It requires the patches to be applied to the skin with adhesive, and then you typically will wear those patches for 48 to 72 hours before you return to have the patch syringed. After the first reading, there is typically a second reading that is another 48 to 72 hours later for what we call late reactants. So patch testing is quite a commitment on both the part of the physician and the physician's office as well as the patient. Before entering a patch test experience, you need to be prepared for that sequence of events. One of my most memorable patch test experiences was a young boy who had horrible eczema at baseline, we thought, but he also rode horses as a hobby. And he developed this awful dermatitis on his feet and legs that we could not control with the typical topical steroids or other interventions. So I thought this might not very cure just fine, no eczema, perhaps you're allergic to something. When he did his patch testing, he ended up being allergic to a chemical that's used in creating a bit of shoe wear. And so he was actually allergic to his riding boots. Unfortunately, it made a huge change in his life because there really isn't a way to avoid that in leather shoes. And so it had to become more of a limited hobby because of his allergy to the leather and shoes.